Today's guest is someone operating at the intersection of healthcare transformation, cloud modernization, data architecture, and responsible AI adoption. We're joined by Kas Parthasarathy, healthcare technology leader with more than 23 years of experience helping provider organizations to modernize clinical, operational, and research ecosystems. At Amazon Web Services, Kas leads healthcare solution architecture, supporting some of the largest provider systems and academic medical centers in the country. He helps CIOs, CDOs, CMIOs, CXOs, and a lot of research leaders align cloud, governance, interoperability, and AI into a scalable enterprise transformation strategy. Kas, welcome to the show. I'm very, very excited to have you with us today.
Well, thanks, Arvind. I really appreciate the opportunity to be on your shortcast.
Awesome. So, maybe we'll start with a little bit of introduction about yourself.
Yeah, so I have been in the data and AI space all my life, about 23 years, as you said. The real traction for my career happened when I started working for a healthcare organization. And that's, I would say, the starting point of my passion aligning with career. I want to be able to solve as many problems in healthcare. I know that, you can't conquer them all, but you need to pick your battles and find opportunities to solve for.
You have described healthcare as a structural modernization gap, right? So fragmented data, siloed platforms, disconnected operating models. Why is healthcare struggling for so long to get modernized when you compare to some of the other industries like retail and CPG, for example? Where's the gap?
Yeah, so the first thing to consider is healthcare is a highly regulated industry, just like the financial and transportation industries, right? The reasoning behind that is, you could go slow in terms of technology, but you don't want to harm a patient in the name of going fast with technology.
Yeah.
So that is a primary reason that you will always, as you know, healthcare lags behind other industries in this regard. But it's also about making sure that we are being very responsible in deploying technology in a way that is safe and, meaningful for us as patients, us as providers, as well as parents who have the responsibility to take care of our kids, right? Having said that, there are opportunities for us to speed up what we do today within the bounds of regulatory frameworks, right? So that is an area that when I say we, it's the major technology organizations that build and deploy technology for healthcare. That is our focus. And how can we create healthcare products that are responsible and safe and secure and be able to deploy it and earn trust, more importantly, of our clinical cohort as well as the patients.
Yeah.
So from that perspective, we have done quite a bit of work, and you've been part of this industry. So as you know, first is making sure that we build products that are aligned with all the regulatory requirements. And then making sure that we deploy them responsibly and safely in the point of care, endpoints, right? And doing so requires not just technology, a lot of people and process aspects that need to be addressed as well. So so that's where we are seeing a lot of friction. The technology is there, to be able to be safely used in healthcare, in aligning with the regulatory mandates. So we have the technology. Now it's about how do we ensure that the people and process aspects catch up to the technology capabilities. And that is definitely, I would say, one of the challenges in being able to address that structural modernization that you were talking about is, how do we ensure that we bring the organizational transformation and mindset shift in making sure that we catch them up to the technology capabilities?
No, makes sense. See, in other industries, life and death situation is more figurative. In healthcare, it's literal, right? So everything you do does impact the patient, does impact the point of care. So you've got to be really careful. Totally get it. Look, I think talking about regulation, I've known this word called interoperability since the HL5, HL6 days, and then we now have FHIR standards and so many other standards to talk about. But simply put, if I have a primary care physician and I go and deal with him or her for a particular issue, and this time I go to somebody else, even till today, them knowing me as a patient who have gone with PCP1 and now to PCP2 doesn't exist. I would think that this is a problem with interoperability. I'm speaking in a layman's language. But at the
Right.
end of the day, it is still not a reality yet. So why are we still stuck with this interoperability situation?
Yeah, you hit one of the most challenging pain points in healthcare. And as you rightly put, it's about how do we ensure the data flows seamlessly
Yeah.
between these different point of care entities that we visit, right? You have the specialists that you visit, the primary care. Sometimes, when during the weekends you need care, then you go to urgent care or sometimes ER, God
And now
forbid.
virtual care, add that into the mix as well, right?
Right. So all of these modalities exist, and we want to be able to consume through all these modes, right? So that means that there is a obligation as a healthcare community for us to be able to provide the patients the ability to seamlessly consume all these different modalities.
Mm.
So to make that happen today, like you said, it's a huge challenge. Why? Because what I've seen in a healthcare structure like we have set up in the US, where there it is a commercialized health system mostly, and where there are different options available for you to, seek healthcare.
Yep.
Who pays for, bringing all of your data together? That's the first challenge that I've seen. I've
Mm.
tried to, so there is definitely technology capabilities available for us to easily put all of this data together. As you rightly put, we have FHIR as an interoperability standard. We've got, even if we don't have an interoperable standard, if there is a willingness, then I'm pretty sure that with the technology that we have available today, making sure that we bring all of the data together from these isolated entities that we visit should
Mhm.
not be a challenge. Where things fall apart is the question of who pays for it. Should the primary care physician pay for it? If so, then how are they getting compensated on that? Should the hospital systems pay for it when you just visit the hospital systems maybe once in a while, unless you are let's say, a chronic care patient? That's a challenge. And then if we look at the other side of the equation, the health insurance payers, right? So
Mhm.
do they need to own that data? Well, the answer there is surprisingly, the payers actually have access to most of your data, right? So they
Of
get
course, they
access to
manage our
all.
benefits. Why wouldn't they, right? I mean, I claim my
Right.
benefits for PCP1 or PCP2. So of course they should. Yeah. Yeah.
Right.
Yeah.
So this is where I think there is a huge opportunity for not health system, but health plans to own the holistic data for their members. And there is also a possibility that you could be shifting from Blue Cross to Cigna to Aetna and all of these different carriers. So at that point, then the responsibility of transitioning the data needs to be seamless. And that is something, again, technology shouldn't be an issue today, because if I'm managing 10 to 50 terabytes of data for one patient, and they're my member today and they shift to another payer tomorrow, then shifting that data out of my system into that other system should not be a challenge.
Right.
So that is something that we have to impact or influence at a policy level. And
Federal level rather than a state level, right? Because I used to work with 7 out of the 35 Blue Crosses. And I would say interoperability, even within these Blue Crosses for a member who's going from one state to another, right, was terrible. Like we had to
right,
face that problem to solve. And to your point, the standardization of data and who's going to pay for it were the biggest problems. Even though
right.
interoperability, exactly what that means, right? It wasn't interoperable.
Yeah, and to your exact point that you just said, what is happening right now is there are some mandates that are coming out, and there are also mandates that have come out. It's called the CMS 0057F mandate. What it requires now is both payers and providers need to have API-based capabilities that will help these different entities be able to share data and freely enable bidirectional exchange of data, provider to provider, payer to provider, as well as payer to payer. So
Yep.
these capabilities, the mandate is already in effect. The requirement for these programmatic transfer of data, these interfaces, which we call as APIs, they are required to be in place by January 1 of 2027. So the mandates are already there. That means that it's no longer a nice to have capability for
You're penalized if you don't have it.
right. So
Yep.
now, come January 1, 2027, everybody has to take care of this.
Right.
Now, at that point, I think we can get to what you're, envisioning here, which is how can we make sure that data flows seamlessly across these different entities? Because now what is going to happen is all these programmatic interfaces are going to have to be set up. If a primary care physician is able to get data from a urgent care facility that say you visited some place in, let's say, California while you were on vacation, it's possible because all that the provider needs to do is query your health plan for, hey, can you give me all of the data for this particular patient that might be outside of my last visit, and I want to be able to use all of that data, right? So
Yep.
it is definitely a possibility. Now, again, that is going to introduce additional cost to these health systems, right? If you're a large hospital, you can, shoulder that burden because now you're enabling these programmatic entities.
Yep.
How do primary care physicians,
SMBs.
specialty
Yeah.
practices make this happen?
Right.
That is where I think there is a need for creating products or community focused products that, multiple specialties can share in instead of them
It's like
having
a
to.
shared marketplace kind of an approach where you have this
Right.
product sitting and shared across multiple entities. And then
Exactly.
how can a provider benefit out of these shared products, right? Something like that.
Right. And that is something that we are also seeing very interesting business models emerging out of, where you have these value based care organizations, or ACOs as we call them, affordable care organizations, that are
Yep.
forming right now that involves multiple specialties coming together, multiple primary care physicians coming together, and creating these affordable care organizations. That means that they can share the cost of technology infrastructure that they implement, and they're also able to negotiate better reimbursement rates from their health plans because they're not now a tiny mom and pop shop. They are a conglomerate of multiple provider facilities. So they are incentivized both ways in being able to provide a continuous or a comprehensive patient care, as well as be able to get reimbursed for the work that they do, right? So today, most of the care is episodic, meaning that the doctor gets to see your
One.
vitals for the day, and they get to see, here's what I gather from talking to the patient for like 15 minutes, and here's my diagnosis based on that. They probably go back and look at your chart for maybe the past 2-3 months, but rarely do they go beyond that, right? So that is usually the mode of operation. But I think the intentional shift is happening, and patients are demanding for more of a holistic care. Because if you think about it, it's, you are in the data and AI space. We don't, create data products or, predictive products that just look at the past 2 months worth of data. You're looking at a statistically significant data volume to be able to create any predictive products. And that might be years of data.
360. Yeah. No, no, I agree. I agree. It's exciting times. I'm gonna have one question added to this. See, you're only talking about providers, whether it's specialty clinics or big hospitals, but there is a new type of data set in town, right? These are your Fitbits, your devices that you're wearing, which is like my ring, right? My Aura ring. This is monitoring my vitals 24/7, 365.
Right.
Now, I know that my physician does not have access to my Aura Ring data. But at the end of the day, when I go to my PCP, I'm shocked. And this is real. They ask me, Arvind, do you have your app for Aura? Can I take a look at it? Right? And they do diligently look at my app to see what my vital signs are, how am I sleeping for the last 6 months or so, what are the patterns. So I'm very proud to say that the PCP that I work with, he actually starts looking at these kind of data, my Garmin data, my Aura data. So are large organizations actually starting to consider these as a part of your analysis as well? To your point, patient 360. What are you seeing in the
Yeah.
market? This is where
Yeah.
AI comes in, and I want to get there as well.
So, as part of what I do at AWS, we work with health systems, we work with payers, health tech organizations, medical device organizations, and I'm seeing an intentional shift to be able to take what we call as this personal health data coming out of devices like the ones that you just mentioned. And how do we make sense of that data? How do we safely and responsibly integrate that data into the care continuum? So that is a question that a lot of health systems are asking, and that is making the med device manufacturers wake up to that fact, right? So, you have these personal devices that you talked about, the Apple Health devices. You
Yep.
also have in chronic care population, what you will see is home health devices that these
Yep.
chronic care patients have. So,
Yep.
how do we efficiently integrate all of that data? And that is where the conversation goes into multimodal data assets that you
Yep.
can produce. Now, again, it goes back to the challenge of who owns the infrastructure that houses
Pays
all of
for
that
this.
data,
Yeah.
right? And that is a discussion that keeps coming up again and again. And when we talk to med device manufacturers, and because we see multiple sites, we see the health systems, and then we talk to them, and then we also have these personal health apps that are coming out now a lot. So what these personal health apps do is they capture some of the personal health device data and bring it all
Yep.
together, right? So they are doing that work. And what they have been asking us is how can having the access to both businesses like us and the health systems, how can you make sure that we both plug into each other and make this a care continuum? So that is happening a lot right now. So a few organizations that I've worked with, what they have done is that, it's one thing for you to have a physician, like your primary care physician, who's very modern and, forward thinking or future thinking, to have that vision of, hey, you know what, I'm going to look at Arvind's data, make sure
Yes.
that I understand everything that's been going on for the past 6 months. So what's happening there is he's trying to use all of that data that you provide him
It
and
is
not make.
just one clarity there. It is still not integrated in my patient record,
Yes,
right?
right.
He is looking at it independently, and as a human, he's taking a decision that Arvind's sleeping patterns are great in the last 6 months, which means I'm going to expect good results from him when I go on my, bi-yearly check, annual checks, right? Biannual checks. So it's
Right.
more of a instinctive decision than an integrated decision, if that makes sense.
Right. And that is the exact challenge now, right? So how do we make sure that, as more and more practitioners are waking up to this fact, how can we take some of these personal health entities? So, the way forward, I think, is for us to, as consumers of healthcare, to go get these personal health apps that are certified to be able to take data from your personal health devices and make sure that they put the guardrails in place to make sure that this data is something that is certifiable to be clinical grade. And then once they have that capability and because they have the regulatory certifications in place, then they can take their data and push it through what are called health information exchanges, which
Yep.
are now transacting a lot of this data and use that as the front door, the health information exchanges as a front door to be able to feed the data into these health systems that are actually going to be making decisions on your behalf, right? So
Fascinating.
when you go for care, that is
Exciting.
something that we are
Really
seeing
exciting.
emerging right now.
Yeah. See, a lot of my listeners care about AI. So I am going to jump into that because you're coming from, probably the world's largest AI user, both Amazon and Amazon Web Services, right? So now you have talked a lot about governance, trust, and responsible. You didn't use the word AI, but I'm going to paraphrase it, right? Healthcare is one of the highest stakeholders in that responsibility and trust or governance and trust, right? In your experience, where are the leaders and laggards, especially leaders? What are they doing differently than the laggards? That innovation is not just, hey, I'll throw AI in front of this and I'll let AI figure out, but there is also responsible innovation. Where are you seeing the leaders going? Like, what are two or three patterns that my listeners should think about on that space?
Wow, that's an amazing question. So, the way that I've seen customers adopt, so I will say that it's not just anymore of the early frenzy where people were reaching out to us and going, we want to use AI, help us figure out how to use AI. So it's like a tool in search of a problem. So that's where we were about 2 to 3 years ago.
Yep.
People were, desperate to use AI, but it's like saying that I want to run an Olympics, help me run,
Yeah. Train
100
me
meter
so that I can
race.
help run the Olympics. Yeah, 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 yeah,
Right.
yeah.
But the problem is that, your body is not conditioned to be able to run the Olympics take that kind of rigor, right? So that
That's
is
right.
where organizations were, and that is a data and foundational infrastructure challenges, along with your organizational, mindset and how you operate as an organization, right? So those were all systemic challenges that we saw that were
And I'll add
blockers.
one more to it. Sorry, Cass. I'll add one more to it. Every CEO in any industry are now feeling the FOMO of not using AI as a part of their strategy because they're afraid that they'll be left behind with this technology, unlike anything else that humankind has invented in the last century, right? So there's the
Right.
underlying pressure of FOMO as well. Every healthcare leader that I've talked to so far, they've always been saying, yes, we're proud to use AI for this and that. And I'm like, okay, what value has AI added? But to your point, it's a hammer trying to find a nail, right? I have a
Right.
hammer AI. I don't have nails, but I want to go find it. So please
Right.
continue. Yeah. So this is a big pressure situation for a number of CEOs in the healthcare industry.
That's right. And you just, again, going back to that hammer and nail analogy, you just
Yeah.
hit the nail on its head. It's the board's leaders asking the leadership within all of these different organizations that are part of the healthcare systems going, how are we using AI today? What are we doing with AI?
Yeah.
It is a challenge, but I also see that as an exciting opportunity where people were so hesitant. I would go back to even 2020s when we were so hesitant to be able to use AI in healthcare. People are now coming to us, like I was saying, and asking, how can we use AI? So it's a good problem to have. Now, that means that there is an intentional mindset shift that we are seeing across every organization that operates in healthcare for the need to deploy AI. There is, again, going back to the Gartner's famous hype cycle, that hype is there. Now it's about how, as technology organizations, we leverage and harness that hype responsibly and use that as an accelerator to modernize healthcare. To your point, you asked the question, why is it such a challenge to modernize healthcare? Well, we've solved the mindset problem now. Everybody wants to use AI, right? So that's a good problem to have, and it's a very exciting time to be in healthcare because of that. Now it's about, okay, we have the right mindset and willingness in people to be able to solve this, willingness in organization to provide the budget to be able to address these AI solutions. And yes, it's going to be, at least for the next few years, I'm under no illusion that we're going to be able to find the right problems and see if AI is the right fit for that particular problem and solve the problem. I am myself seeing more and more that I am getting involved in scenarios where with customers we talk about how do we use AI to solve some of the problems. And
Yeah.
then we work, in the reverse order saying that, okay,
Backwards from the, yeah.
yeah, we want to use AI.
Yeah.
What are things that we can do?
Right.
So, in there, to your point, there are some challenges that organizations are running into. And, you asked what are the different patterns that we are seeing here, right?
Correct. Yeah. Two
There,
things that I'm looking for from these leaders, right? You have obviously seen organizations adapt and adopt to AI and be successful at it. So, what are those patterns that are emerging where you see AI getting used?
yeah, so the successful organizations that deploy AI and meaningfully use them, when I say deploy, there are organizations that have AI but not meaningfully used as well. So the successful organizations that deploy AI and see meaningful usage and not just see meaningful usage but have an impact on their business outcomes,
Yep.
right? That could be either financial or
Clinical.
brand value,
Yeah.
right? So from that perspective, what we are seeing is organizations that intentionally and prioritize what areas that they want to be able to use AI and make sure that they protect and preserve their organization's capabilities to be
Mhm.
able to work on those. So, as an example, you could be looking at taking a clinically sensitive use case that requires a lot of data, as in, oh, I'm going to predict if this patient is going to become diabetic in the next 5 years. Well,
Right.
that requires a lot of data, regulatory mandates. So there are organizations that have established AI governance councils that have specific mandates on what type of AI projects that they want to take on. And those are the AI projects that go in the automation space, right? So how can we automate a lot of manual stuff that we do? If you look at healthcare, we spend close to $200 billion in manual administrative work. How can we automate most of those? And while we do that, how can we ensure that we educate our people on AI? So both just-in-time training as well as creating intentional programs within their organizations to bring AI awareness. So that is what I'm seeing as a very promising trend where organizations become successful in adopting AI, where the top-down leadership says, we have these business goals that we have set for our organization. And these are the things that we want to achieve, like, increase our margins from single digits to about double digits.
Yep.
That could be a very simple low-hanging fruit. Now, how do we achieve that with the help of AI? And then saying that, okay, now let's also make sure that all our people are trained and AI aware. And now let's work with organizations that are good at deploying these AI capabilities, find the right ones, and bring them in and make sure that we bridge our goal of using AI to achieve our business outcomes and the people that are eventually going to own and execute on achieving those goals using AI, right? So operating from both perspectives. That is one pattern that I've seen work really well where organizations create the AI governance council that brings both these ends together and make them meet. And
I have to tell
another
you a funny story on this pattern. So, Gen Z kid and I, we went to a healthcare call, right? So we were talking about claims processing and, claims processing is still a very outdated process. And we were talking about how do we automate some of that. And then somebody said, oh, we still use fax machines and we fax our claims from this and that and the other. And then this kid was texting me on the side. He goes, what is a fax machine? I'm like, oh my good Lord. So it was hilarious. I just laughed it out in the middle of a call. I know he was joking, but at the end of the day, these people who are just coming into the workforce, they don't know things like this. It's like mainframe days when we started working, right? And people still use mainframe. There's nothing wrong with that. But a lot of the modern doctors who are coming to the field and modern, health practitioners, they don't understand these old school ways. They are AI first. So their thinking is very different. If I have a patient data, could I use something like a ChatGPT or a Claude and put it out there and say, what are the trends I need to think about for this particular patient, right? Especially with chronic
Right.
illness. How do I make them feel better? So I just want to kind of call that out, that fax is still alive and well, and people are still using it for things like claims processing.
Yeah, that is, I mean, we have a advanced version of fax now that's called eFax.
Oh my
So
God, same thing, same
so
thing.
we have advanced a little bit more, I would say. So that's definitely an area of opportunity, right? So how can we improve there? Two other patterns that I've seen that have emerged that are really interesting is, you kind of alluded to this where there are organizations who are AI first versus organizations that are, trying to bolt in AI capabilities after the fact.
Oh, the FOMO AI organizations, right? Oh, he does
Right.
it, so how do I do it, right?
Yes.
Yeah.
So the AI first organizations, the way they think and they go about doing things is fundamentally, they first think about if something needs to be done,
Hmm.
can AI do this? And can AI do this safely and responsibly? They exhaust all of the options before they resort to a manual process. Whereas AI capable organizations implement processes and then they
Yep.
see how can AI assist us in making these processes go faster, right? So it's like I always give this analogy that when we think of aliens invading Earth, we always think of them having a head, two eyes, hands, and
Green
limbs.
face.
Yeah. And that
Yes.
is just a human way of personalizing, a completely abstract concept into our own way of limited existence, right?
Right.
So that I would say is a huge challenge with AI capable organizations or organizations that are retrofitting AI is they still think the old fashioned way, meaning that, okay, so let's implement this referral process where we get all the faxes. Let's take all the faxes and now use AI to figure out what can we do with the faxes.
Right.
Well, why not eliminate the entire fax chain and then go talk to how the health system that is feeding data to you can feed that data to you. What are the things that we can do to solve that problem as opposed to retrofitting AI into a manual process? So that is another pattern that I've seen organizations that are really successful in adopting AI leverage. And the third thing that I've seen that is very interesting, and this goes to the point of, I mentioned two ways of using data, right? So
Yep.
AI, where you don't necessarily need data and context, and that is things like, we are talking right now, and AI is transcribing as an example. The same way, organizations have ambient documentation that they have
Yes.
implemented, right?
Yes.
So
Yes.
that saves a huge amount of time for providers. You
Yep.
don't need, an extensive, data and AI foundation to have an ambient documentation AI solution or a fax reader AI solution, even though that is a retro. So there is that part where you can use AI today without having to rely or have a very strong base. But then there's the other side of the equation where let's say you want to verify a patient's identity and then be able to schedule an appointment for them. And we have built agents for all those at AWS. Those capabilities require data, right? So you need to have connected data flowing across multiple systems to be able to make that happen. Therein, we are seeing a very interesting shift. So in the olden days, we used to have the problem of how do we bring all of this data together, structurally align the data, make it pretty, make it all talk to each other and all of that. But now there is an interesting trend emerging where we are more focused on contextual and the metadata layer as opposed to the raw data layer itself. So organizations that have set themselves up using the modern constructs of a data lake plus, just-in-time consumption using these contextual and metadata layers instead of trying to hack the data at its foundational level, we are seeing a lot of traction for these organizations to be able to put agentic solutions on top of their data because their data is already ready, because they are not trying to fix the most voluminous aspect or what I would say, the fundamental aspect, but they are wrapping their data around a metadata layer, which takes care of all the changes that happen in data on a day-to-day basis, right? So that is another interesting pattern that I'm seeing.
So shameless plug, I actually released a video just a couple of weeks ago talking about metadata and data context, the difference and the similarities between both. So context layer is becoming a very, very important conversation for all data practitioners, right? And this is across any industry. In fact, it is so much so that Gartner even highlighted in their hype cycle that it is slowly going towards the peak, right? So, and obviously with better context, AI behaves better. So I want to kind of summarize for my audience. I asked you three, you gave me four. But I do want to make sure that they kind of think about these things, right? Especially the healthcare practitioners. So number one, you told me collaboration and governance, bringing the business and IT together, bringing the physicians and the technologists together to try to understand how can we build a AI capability that will serve the make money, save money, efficiency, all of those kind of items, right? So how can it bring value to the organization? That was number one. Number two, you told me reimagining business. So this is instead of a hammer finding a nail, instead of saying, I will get the claims in an eFax machine and then I'll use AI on top of that. How do I reimagine that process so that it becomes AI first and not AI after, right? So instead of, you use the word retrofitting AI, if you will. Right. And then number two, I heard you talk about small and quick wins. So the easiest example that you had stated is doctor notes and the transcription of that. And how can that be integrated to enterprise data so that now you put a full 360 of a patient, right? And you understand. And now there are, as you said, AI tools available. Doctors are using it, right? So how can we do some things like that and slowly build upon your AI foundation instead of doing the big bang approach, right? Organizational AI transformation doesn't exist yet, even though people tend to think that all these big buzzwords, right? Last but not the least, this is near and dear to my heart. Data is the lifeblood of AI, right? That doesn't matter what industry it is. And you mentioned context, which is now pretty much the talk of the town. And, there are capabilities out there that does context layer for you. Okay. And obviously data governance, the quality and the lineage of the data, this is equally important, if not more. So I know this is absolutely fantastic, Kas. I enjoyed how you've kind of broken down and gave specific examples on each one of these. Now, I know you're not a magician, but I'm going to ask you to spin your 8-ball and think about, say, 10 years from now. If Kas were to say, yes, as a healthcare expert, I've made a small dent in this universe, right? If you were to look at your crystal ball and tell me what that is, what would that be 10 years from now, something that you have accomplished and the healthcare has accomplished that you were a little part of? What would that be?
Yeah, well, I'm very passionate about healthcare. One of the problems that I want to solve is, to your point, being a data guy, the data problem, right? So I want to be able to solve that data problem so that one day when I go to a primary care physician, a specialist, a ER and an outpatient facility, as I age, my goal is that I should be able to have my data seamlessly flow into all these entities and all of this data to be readily available for these physicians, and that they also have the ability to, look at 2 years worth of my data to be able to provide me meaningful care as opposed to just episodic care.
Yeah.
So to that end, I would say that, what does it take for us to get there, right? So as health systems, health system leaders, what I would say is we need to learn to figure out what part of this technology infrastructure we need to own versus what parts do we need to leverage. We call it undifferentiated heavy lifting. How can we take all of this undifferentiated heavy lifting work that we need to do to people that can do it? So we at US and other hyperscalers do this. You have got Databricks, you've got Snowflake, and all these major data players. How do you figure out a organizational approach where you take all of this undifferentiated heavy lifting and make these organizations do, while we figure out what is our mission and how are we uniquely differentiated in delivering care? We have multiple health systems here, what is that? Baylor Scott and Texas Health Resources. So we've got all these. So how do we differentiate us as a care provider? So that is the portion you want to focus on and build technology capabilities that align with that. So that is something that the health systems need to take care of. And what should also happen from my perspective in the next few years, and I'm seeing a very bright sign here, is the industry is converging around FHIR,
Yes.
which is becoming quickly the
Standardized. Yeah.
interoperable standard.
Yeah.
And interestingly, because we are converging around FHIR as an interoperable standard, when I talk to healthcare organizations today, I'm very bullish about FHIR becoming the common data model for healthcare. We don't
Yep.
have one in healthcare. And
Yep.
FHIR provides us by far the most promising solution to creating that common data model. When we have that common data model, and to your question of in 10 years, can we get there? I think we can absolutely get there. If we do, I think we have the opportunity to be able to realize the dream of continuous data flowing across these multiple systems.
And I think one thing to add to this is that AI is almost going to force you to get there into this common data model, right?
Yes.
When your context is going to change from person to person to person, you need a common and a consistent data model for AI to understand, to have consistent decisions taken, right?
Right.
So in some ways, you have a forcing function in AI to get you there. Whether it's a FHIR standard or some other standard tomorrow, I don't know. But there will be some standardized data and standardized model. Every industry is going through this as well, right? So
Right.
yeah, that's a fantastic point.
And one other
Cass,
thing I would say
yeah,
is,
yeah,
price transparency, right? So healthcare is the only industry where you don't know what you're going to be paying for. And in 10 years from now, I think that will also be a reality that is, coming to life because we are now standardized on these common data models. And because the regulatory mandates are pushing health plans and systems to be able to publish the pricing aspects, right? So all of that
and
data today gets published. I don't
yes.
know if many of your listeners are aware of this. A lot of health plans like Cigna and everybody, they publish their price, quotients, the pricing tables, but all of them have their own different formats. So if you had to go try to put all of this together to find out what the
Cost
pricing
of it look
difference,
like. Yeah, yeah.
it's a nightmare. But once we standardize on a common data model, I think all of that data becomes readily available. And to your point, because we can now have these intelligent agents sift through earlier, if you had to go through a JSON format, which is what FHIR is, it's very difficult for a human or an analytic system to do that. But with LLMs, we have almost removed that need. In fact, I would even argue that more than tables, these JSON formats are more conducive for LLMs to read and
Oh
make
yeah.
sense of. So, given that, I'm very excited about the future of healthcare, that we are headed in the right direction with technology, again, being the companion that doesn't take away the people mindset process aspects. And that is a huge area of interest and opportunity and passion for me. And, at ABS, a bunch of us came together to put together what is called the data strategy diagnostic assessment. The idea is for us to help people address the mindset, people, process aspects along with the technology to get us there. So, yeah, I think 10 years from now, I'm very confident that in a very small way, I could have influenced healthcare and made a positive difference.
I hope 10 years from now, you and I can have a beer and we can talk about meaningful care versus episodic care, right? So, and I hope I can understand a full life cycle of my meaningful care, because you and I may or may not have teeth like we do today, but we'll see where that end up with. Kas, it is a pleasure having you in the podcast. Thank you so much for joining us. Your passion for healthcare was clearly visible across the podcast today. Look, wish you good luck, and you at US are doing some phenomenal things. I will post your LinkedIn as well for all my audience, and team, feel free to reach out to Kas. He is your true healthcare expert. Thank you for being with me today, Kas.
Yeah, and thank you, Arvind. I know that you are a veteran in the data and AI space, so giving me the space to talk about data and AI while you're patiently listening, I really appreciate that. I know that you have a lot to offer in this space as well, and hopefully we can collaborate at some point.
Thank you.
All right, thank you.